So if these are things that you've been thinking about or that have been driving you crazy, or whatever the situation is, there's a way that you can sort of improve the quality of your life, and and that's what we're here for.
Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. We are so excited to be here for our Labiaplasty series. My name is Dr. Ashley Amalfi and I'm one of your co-hosts, and I'm joined with Dr. Smita down in New Jersey, who's my good friend. Hi girlie.
Hi, how are you?
Good. We are so excited to be continuing to talk all about labiaplasty, so you've learned a lot of the basics. I mean, I think the next thing that we need to talk about is what kind of symptoms are we hearing patients come to the office and complain about? So, what are the big, the top, handful of things that patients come to you and complain about regarding their labia?
Right. Well, I think as far as symptoms, right? So I think if you sort of look at all of the patients that I see, right, there's the category, or there's a group of patients that just don't like the appearance. They don't
100%.
have any symptoms at all. They just wish their labia looked a different way. So totally valid, normal, but then there is the other group that actually get irritation. And that's typically, at least in my patients, where the labia minora, so sort of the inner lips hang low or protrude. Yeah. And they could either evenly protrude, or one protrudes one side more than the other. But it can get caught in clothing, workout, like yoga pants, underwear, even irritation during sex, and just, if they're spinning or any activity that they do, they just find that they're getting a lot of irritation and discomfort. Yeah. So, I mean, is that similar for you too, Ash?
I mean, even sitting, like some people say that like when they sit, it's uncomfortable and they have to like wiggle around to get comfortable. I mean, it doesn't sound fun, I mean, it sounds like these kind of things, I think, just really interfere with people's lives, and they're not awful, and, it's not like they can't do these things, but they're annoying, and they're bothering them. And I think it's valid if something's really driving you crazy and there's something that you can do safely to fix it, then, those are all reasons that we see. So you can have some of those symptoms. You could just be like a cosmetic patient who doesn't like the way it looks, or sometimes you don't like the way it looks and then you have some of the symptoms as well. And if you have one or all or none of those, all like really valid reasons to come see a board certified plastic surgeon and talk about labiaplasty, right?
Right. Yeah, I mean, I think especially since this is such a safe procedure in the right hands, right? So if you are going to someone who is trained and understands the anatomy, it's a quick procedure, and we're going to talk all about that in the series. But it's a quick procedure, and it's safe, and if you're in the office, you go home the same day. So if these are things that you've been thinking about or that have been driving you crazy, or whatever the situation is, there's a way that you can sort of improve the quality of your life, and and that's what we're here for.
We've got you covered. So start thinking about it, and find yourself a good board certified plastic surgeon, or come find us, and we would be happy to help you. So lots more questions answered heading your way on some more episodes of Lipstick and Lipo in our Labiaplasty series. See you soon, guys.
See you soon. Bye, guys.